Hello class, today we're going to talk about chapter 15 in your book, which goes over topical, ophthalmic, and otic medications. Our learning objectives are to describe the skin as an organ, describe the physiology of the skin, describe the classes of topical drugs and the skin conditions they treat, explain the action of the topical corticosteroids and their application, recognize the classes of antiseptics and disinfectants, recognize ophthalmic and otic agents and their uses. So the integumentary system refers to the tissue that covers the body and includes skin, nails, and hair. This system protects the body from exposure to harmful pathogens and harsh substances and helps to regulate body temperature. The skin is technically the largest organ of the body, and it usually accounts for 16% of your body weight. There's 3 layers of the skin: the epidermis, the dermis, and the subcutaneous tissue, as in this really gross diagram here, which is on page 620 of your text. I don't know why I find that gross, but I do. The epidermis is the top layer of the skin. It forms new cells and sheds old dead cells. It produces nail, hair, and glands, and it's interspersed with melanocytes. The dermis is located below the epidermis. It's composed of connective tissue, capillaries, and nerves, and location of the sebaceous glands and sweat glands. Subcutaneous tissue is the innermost layer, and it connects the dermis to the underlying organs and tissues. Sun exposure and skin cancer. The ultraviolet radiation is damaging to skin. Ultraviolet A or UVA, which is UVA1 and UVA2, and that's also known as the suntan region. Your book goes into more about this on pages 620 and 621, but the characteristics of effective sunscreen, the SPF or the sun protectant layer needs to be at least 30, and it must protect against UVA and UVB rays. If any of you are gingers like me, red hair and freckles, you understand how important the sunscreen and SPF are. There's different types of skin cancer. There's the actinic keratosis, basal cell carcinoma, melanoma, and squamous cell carcinoma. These are listed also on page 621 of your textbook. There's different drug therapies for sun exposure. Dermoplast and lidoderm, which are numbing agents. They temporarily relieve the pain that's associated with a sunburn. Hydrocortisone, which decreases inflammation. And then silver sulfadiazine. If you've ever had that, I'm sorry, that means you've had a really, really bad burn. But it prevents infection and serious burns. Photosensitivity is increased sensitivity of the eyes and skin to light. That risk increases with drugs in certain classes, and you should watch for computer prompts and warn patients to avoid sun exposure. Classes of drugs include ACE inhibitors, antibiotics, antidepressants, antihistamines, antipsychotics, cardiovascular drugs, chemotherapeutic agents, diuretics, hypoglycemics, and NSAIDs. Acne is the overproduction of sebum, which causes hormonal changes. This includes pimples, blackheads, whiteheads, deep cysts, and serious cases. Page 624 in your book goes over that a little bit in more depth. A wrinkle is a line or crease in the skin. It's promoted by sun exposure, smoking, lighter skin, and hereditary. It is also just part of aging. Rosacea is the chronic inflammatory disorder seen in adults. It includes redness, visible surface blood vessels, raised bumps. It's triggered by stress, temperature, hot drinks, exercise, spicy food, alcohol, products which irritate the skin, and sunlight. There are some drug therapies for acne, wrinkles, and rosacea. For acne, you should cleanse twice a day. There's some over-the-counter products and topical prescription products and oral prescription products that all can be used for acne. Wrinkles, you would use retinoid creams on those. and rosacea. You should identify and avoid the triggers that are associated with rosacea. That's different from person to person, but there are topical agents and antibiotics that can be used to treat rosacea. Here are some topical medications that are listed for acne, wrinkles, and rosacea. They're topical antibiotics, and your book goes into more depth on those on page 625. So pharmacy technicians should be aware that the use of retinoids to minimize the sign of aging is considered by many insurance companies to be cosmetic rather than therapeutic indication. Consequently, these companies deny insurance coverage for the cost of these medications. It can be helpful to warn patients that these products can be costly before they have their prescriptions filled. Here's some topical medications for rosacea and acne. So provide side effects of topical antibiotics used for acne and rosacea. Again, these are covered on page 625 through 627 of your textbook. But the side effects include dryness, redness, burning, flaking, and peeling skin. Dermatitis is pruritic, inflamed skin that can be caused by a variety of factors. Symptoms include areas of redness, dry, flaky skin, raised or bumpy skin, and pruritus or swelling. There's different types of dermatitis, which include contact dermatitis, seborrheic dermatitis or cradle cap, which is found in infants, diaper rash, and eczema. Psoriasis is an immunologic condition. It manifests as well-defined plaques that are raised, silvery, or white, flaky, and swollen. They can appear anywhere on the body and may be very small or quite large, and they're exacerbated by stress and environmental factors. The different drug therapies for dermatitis, eczema, and psoriasis are listed below. There's topical corticosteroids and oral corticosteroids for dermatitis and eczema. For seborrheic dermatitis, good hygiene is important. Some therapies include topical antihistamines and anti-inflammatory agents and moisturizing creams. For eczema, moisturizers, topical corticosteroids, and topical antibiotics for infected areas. And then for psoriasis, corticosteroids, immunosuppressants, and immunomodulators. So I'm sure you've probably all seen those commercials on TV with Cyndi Lauper on there that says that clear skin can last. Those are examples of immunomodulators and immunosuppressants. Drug therapy for dermatitis, eczema, and psoriasis, including topical corticosteroids. The way they work is they inhibit redness, swelling, itching, pain, and the dermal layer. Your book goes into more depth on those on page 630 of your text. Some of these include the following lists here. They're divided based on their potencies. And tacrolimus and Elidel, the way they work is they inhibit T cell activation, which prevents release of chemical mediators that promote inflammation. And I believe, yeah, those are on page 632 of your textbook. They're called calcineurin inhibitors. And 632 will go into more detail about those. So dandruff is a malfunction of oil-producing glands around hair follicles on the scalp, and the overproduction of sebum and cells results in layers of epidermis sticking together and flaking off. Some medications that are used to treat dandruff include selenium sulfide, which is the main ingredient in Head & Shoulders and Selsun Blue. Bacterial infections of the skin, that can include impetigo, and they're superficial, highly contagious, and usually common in childhood. They also generally form around the mouth and face. Let's see. Actually, on page 635 in your textbook, there's a picture of the impetigo that's around a young child's mouth. But pages 634 through 636 go into more detail about these bacterial infections. But there's folliculitis, furuncle, and carbuncle. The different drugs that are used to treat bacterial skin infections, they're just some topical antibiotics, bacitracin and neomycin or neosporin, and then mupirocin or Bactroban. Those are probably the most common that you'll see. Fungal infections include candidiasis. It's caused by candida, and they are lesions in the vagina and the mouth. And ringworm is caused by a microscopic fungus. It's not a worm at all. It infects the skins and nails, and it spreads outward as the center heals, leaving a ring. Page 637 goes into the fungal skin infection medications in a little bit more detail. The ones that are listed here, some of those are over the counter, such as Lotrimin. But like I said, 637 goes into more detail about those in 638. Miconazole as well, it's over the counter. So viral skin infections include herpes simplex virus, HSV type 1 associated with cold sores, and HSV type 2 is associated with genital infection. Warts are epidermal tumors caused by a virus, and that virus may lie dormant and later cause reinfection. 638 goes into detail about those as well. So Virex and Abreva are the two main treatments that are used to treat viral skin infections. Which drugs are used to treat bacterial skin infections? Bacitracin, neomycin, polymyxin, mupirocin, Altabax, erythromycin, and metronidazole. Human lice are external parasites. They're wingless parasitic insects that feed on human blood. They spread by direct contact with infested person's head, body, or personal items, and symptoms of infestation include itching. Page 640 shows you a pretty good picture of lice and their larvae. So there's different types of lice. There's body lice, head lice, and pubic lice, all equally disgusting. Lice and other pathogens can develop resistance to medications. In the past, most lice were susceptible to permethrin and pyrethrin, which are in a lot of lice shampoos. Now lice are developing resistance to over-the-counter products, and prescription agents are needed. There's different drug therapies for lice, depending on what type of lice you have. Body lice, you should shower or bathe and apply 20 to 30 grams of cream or lotion to the whole body and then wash off in 24 hours. Head lice and pubic lice are treated, can be treated with lice shampoo. So these medications are listed on page 641 of your textbook. Scabies is another external parasite that is found in the skin. It's a type of mite, and the female burrows in epidermis and secretes substances that disintegrate the skin and then feeds on that skin. Symptoms include intense itching at night caused by the increased activity of the mite, feeding it and depositing the feces. Lesions are slightly elevated, wavy grayish-white burrows, and the lesions often seen in webs between fingers. Drug therapy for scabies includes permethrin, which is a topical cream. Adults will apply to the skin from the neck to the soles of the feet. Infants and older adults can also apply to the scalp as long as you avoid your face and your eyes. And then you're supposed to wash that off after 8 to 12 hours. The use of Use of disinfectants. You should disinfect instruments, and the best way is best to use 2 separate agents with different mechanisms of actions. And treat infections in the mouth and the body. Oral cavities are difficult to disinfect because very few drugs adhere to mucosal lining long enough to overcome bacteria. These are the different types of disinfectants. They are listed on page 644 and 645 of your textbook. So the eyes, as in these diagrams here, are also on page 647 of your textbook. There's different parts of the eyes. So the eye is the sensory organs that sense light and produce vision. The pupil is the point where the light enters the eye and it's visible as the black center of the eye in the middle of your iris. The lens focuses light onto the back of the eye. The iris surrounds the pupil and determines eye color. The sclera is the outer coating of the eyeball, the white of the eye. The retina contains photoreceptor cells that detect light and color and send signals via the optic nerve to the brain. The rod cells are responsible for night vision and black and white vision. The cone cells are responsible for day vision. The interior chamber holds aqueous humor, which lubricates and protects the lens. The vitreous humor is the fluid inside the eye, and the ciliary muscle holds the lens in place. Glaucoma is the abnormally high intraocular pressure that pushes on the optic nerve and damages it, and it's caused by increased intraocular pressure, the overproduction of the aqueous humor, and the blockage of outflow of the aqueous humor from the interior chamber. Some steps to help determine the appropriate ophthalmic or otic bottle to select. Determine the number of drops needed for the entire prescription. Convert the number of drops to milliliters. Remember that 20 drops is about 1 ml. And then select the bottle that is closest to the milliliters calculated. There's different drugs to treat glaucoma. The way they work is either reduce aqueous humor production or enhance its drainage. And the miotic agents contract the ciliary muscle, thereby enhancing aqueous humor outflow. These drugs are listed on page 648 of your textbook. Conjunctivitis or pink eye is the inflammation of the mucous membrane surrounding the eye. It's caused by bacteria or viruses. Symptoms include redness of the sclera and the insides of the eyelids, itching, pain, tearing, and release of exudate. The treatment includes ophthalmic anti-infectives, and ask patients about allergies and document these in the medical records. These are different drugs that are listed for pink eye or conjunctivitis. They're listed on page 650 of your book. What are the classes of drugs used to treat glaucoma? Prostaglandin antagonists, beta blockers, alpha receptor antagonists, and miotics. So here we have the ears. Listed on page 651 is the diagram of the ear and the inner components. The different parts of the ear. The ear is the sensory organ that sense sound waves and produce hearing. It's divided into 3 parts: external, middle, and inner. The external ear captures sound waves and directs them through the auditory canal to the tympanic membrane or the eardrum. The tympanic membrane separates the middle ear from the external ear, and it vibrates in response to sound waves. The middle ear contains 3 bones, which move in response to vibrations of the eardrum. The eustachian tube connects the middle ear to the throat, allowing fluid to drain and equalize pressure in the middle ear when air pressure changes. Inner ear includes the semicircular canals and the cochlea. The organ of Corti contains hairs which vibrate, sending signals via nerves to the brain, and the semicircular canals maintain balance and orientation. Otitis media, or middle ear infection, is common in children due to poor drainage of fluid from the middle ear. Most are viral and clear on their own, and they commonly develop after a viral respiratory infection in which mucus and fluid buildup, providing a growth media for bacteria. Symptoms include ear pain, jaw pain, sinus pain, itching, fever, and dizziness. Here's some different drug therapies for an ear infection. You have oral antibiotics, topical analgesics, decongestants, and otic antibiotics. The different classifications of antibiotics for ear infections include quinolones, which are ciprofloxacin and ofloxacin, and then combination drugs, which include an antibiotic and a steroid. Otitis externa, or swimmer's ear. The description of that is an infection of the ear canal caused by bacteria or fungi that thrive in most environments, such as cerumen. And the highest risk group are regular swimmers. Drug therapy include over-the-counter agents such as Aerodry or Ear Dry, which is an alcohol and glycerin-based product, and then peroxide, which removes earwax. Complementary and alternative therapies. Aloe gel has wound healing, antibacterial, and antifungal properties. You've seen most lotions and sunburn medications contain aloe. Clove oil is an antiseptic used on exposed dentin, which combined with zinc oxide or zinc acetate. Vitamin A, or beta carotene, essential for photoreceptor growth and regeneration. Deficiency may cause night blindness, and Ocuvite is a combination of vitamins and minerals used to slow progression of age-related macular degeneration. Olive oil is also used. It's contained in some natural otic products to soften earwax, and it can be combined with docusate sodium, which is a stool softener. All right, our chapter summary. Sunscreen should protect against both UVA and UVB rays. Acne is treated with cleansers, antibiotics, retinoids, bromidine, and salicylic acid. Topical corticosteroids are commonly used for dermatitis. Eczema may be treated with calcineurin inhibitors. Dandruff is treated with selenium sulfide. Skin infections may be managed with topical antibiotics. Conjunctivitis treatments include topical antibiotics and steroids. Eye drops are used to treat glaucoma. And antipyrine benzocaine is a topical anesthetic effective for ear pain. If y'all have any questions, please let me know.